Hi everyone, and welcome to my presentation on diastolic function. When doing echo, we assess two things: systolic function and diastolic function. And in systolic function, we assess how the left ventricle is pumping out blood. So EF is supposed to be 50 and above. And in diastolic function, we assess how the left ventricle is able to receive blood from the left atrium. When the myocardium is stiff, diastolic function becomes impaired or abnormal. So in diastolic function, it is the relaxation of the left ventricle that is affected, and the filling pressure goes high. Therefore, when assessing diastolic function, we look at filling pressure, or in other ways, we try to see if the left ventricle is able to fill without excessive pressure. Having said that, let us assess diastolic function or filling pressure using post-wave Doppler and tissue Doppler imaging (TDI). So it is always important to assess systolic function and diastolic function when we are dealing with clients or patients that are 40 years old or above, but also have got a history of shortness of breath and unexplained pulmonary hypertension. Okay, so we'll start with a post-wave Doppler in order to assess the mitral inflow pattern or mitral inflow velocity pattern, and secondly we'll do tissue Doppler. Okay, so we use apical 4 chamber view, and we press post-wave Doppler button, and then the sample gate is supposed to be at the tips of our mitral valve leaflets, not in the left atrium. Okay, right, so then we put set, and then we have that wave, as you can see. So there's a small wave that is called L wave, and we have E wave and A wave. So we are not supposed to have this small wave, which is called L wave, and when it is greater than 20 centimeters per second, it is called L wave diastolic dysfunction. Okay, so now we'll measure E wave. Normally we are supposed to have two, E wave and A wave. So E wave should measure 50 above. So as you can see there, it is measured 51, which is normal, and when it is less than 50, it's abnormal. And when we measure A wave, it will give us a ratio, so that is 0.99. So normal value is 0.8 or greater than that. When it is below 0.8, it is considered to be diastolic, grade 1 diastolic dysfunction. But we also have to check if E velocity is greater than 50. When it is below, then the ratio, E to A ratio, is less than 0.8, that is grade 1 diastolic dysfunction. So after assessing mitral inflow pattern, we'll now go to tissue Doppler. We'll now assess the tissue, and we put the sample gate at the mitral annulus. When we are assessing mitral inflow pattern, we put the sample gate at the tips of our mitral leaflets. So have to take note of that. Okay, so when you press tissue Doppler imaging pattern and then set or update, it will give us that wave. So look, this is different from the one we had. This one, the first one was normal, E wave was greater than A wave, but this one E prime is smaller than A prime. Okay, as you can see. Okay, so the first wave was supposed to be greater than the second one. Okay, so here it is reversed. So this is pseudo-normal or grade 2 diastolic dysfunction. But now we'll try to measure in order to see if it is really grade 2 diastolic dysfunction or pseudo-normal. So we'll measure E prime, which is supposed to be greater than 7. We'll also, that is E prime on a medial wall. We'll also go to the lateral wall, okay, to see if it is on lateral wall, it should measure greater than 10. So we'll start with E prime, that is the first wave, which you see there, which is smaller. Okay, so we'll do E prime, E prime septal velocity. Okay, and we press. Okay, so the measurement that we should have should be greater than 7. So see, so it's 10. So there it's normal. So E septal velocity is normal. We also measure A prime. Okay, A prime, that is the second wave. And when we measure that, it will give us a ratio. So it's 0.84. Okay, that's the ratio that we are given. But keep E septal velocity, because that is very important. Okay, then we'll go to the lateral wall and we'll put the sample gate at the mitral annulus again, so to also give us that wave. So this one is not good, I'll take it again. So here the machine will make an average of E prime septal and E prime lateral. Okay, so already we have found E prime septal, so we want to find E prime lateral. So with this wave, okay, we press E prime velocity, then it is 11.9, which is normal, so it's supposed to be greater than 10. When it is less than 10, it's abnormal. Okay, so now we want to see if the feeding pressure is normal or not. So we'll look at E to E prime ratio. So E to E prime ratio, when it is above 14, it is considered to be elevated, and it is grade 3 diastolic dysfunction. And when it is less than 14, it is normal. Okay, so here what we have found is 4.6. You can check down there. It's given us down there. There's 4. Maybe you cannot see it clearly, but just check. All right. So this is what we have found. So I found that the feeding pressure is normal, but now we can also do other tests in order to confirm whether it is normal or not. So we can do tricuspid regurgitant velocity, which is supposed to be less than 2.8 meters per second, but also we can measure the volume of the left atrium, and it should be less than 34. So if these are also normal, then our examination will be concluded as normal. So for more, you can read my book, that is Screening Echo, which is going at 2,500. That is a soft copy, so you can read more on this one. Thank you very much, and God bless.